Hi, my name is Andrea, and I decided to do my research organization project on the Adams County Office for Aging. It is a private nonprofit agency. It's been around since 1974, located in Gettysburg, right off of Middle Street. The agency's mission is very straightforward, helping older Adams County residents to maintain their independence and dignity. So there's not a lot of philosophies or values that go along with the agency's mission statement. It truly is just kind of goal-based on being able to keep those who are over the age of 60 out of nursing homes and out of medical facilities, with the aim that they can be within their own home for as long as possible. So the agency really partners with a lot of community programs and other agencies to help make this happen. So at this location, there is a staff of 23 workers. One of those is a care management supervisor named Karen Markle, who I interviewed. I was also able to meet with Vicki, who is their financial director. Karen has been their care management supervisor for over 26 years. She's been there a very long time. She has a degree in sociology, and one of the reasons she chose to apply at the Adams County Office for Aging is it was one of the only human services locations that did not require either a master's degree or a degree in social work. So once she kind of got in the door, it kind of stuck, and she stayed from there. There's also over 400 volunteer workers that help out annually, and it could just be a few a week. Some do one day a month. So between all of these workers, it's over about 400 people that help out. So they help out with chores around the elderly citizens' homes. They also help with meal deliveries throughout the week. They may also help with transportation or bathing or shopping. So a variety of things that a volunteer can do to help. There are 14 board members. Those board members are not elected. They are appointed. They're asked to be part of the board to help make decisions that are good for the agency. So while I was there, I picked up a couple of pamphlets. The first one is the Aging Service Directory. So this is the Aging Services Directory. There is an abundance of resources in here, from in-home care agencies to places that you can go for medical equipment, legal services, personal care services, even protective or victims' rights services. So it's a great handbook, not just for someone who's elderly, but someone who's looking to see what services are in Adams County. I was also able to obtain a resource link for Adams County. This resource link is just full of different places that people can reach out to for help. One of those is the Cross Keys Village Brethren Home Community. So they have a home that houses private citizens, elderly people, after they maybe aren't wanting to be at home anymore in their own home, but they're looking to move into a place that has some nursing care and is more of a community versus a regular nursing home. So they have a group of patients that have Alzheimer's that have recently started coming to the Aging Center for a support group. So their families can come there, they can come there as well. I was very impressed with Karen Markle when she used the people first language that we learned about just a couple of weeks ago. She did not describe Alzheimer's patients as Alzheimer's patients. She described them as people needing memory care or memory help. And I thought that was great that she portrayed that image more, that they're just people and they just needed a little bit of help along the way. The other thing that is at the Aging Center is in their vestibule, in their lobby, they have hundreds of different pamphlets. So it might be from victim services to mental health, depression groups, information on food stamps for heating assistance, tax assistance. So lots of different resources that are there to help someone. So it was great to see that there was that many resources there. Later on I'll talk about how I feel like maybe that's a little underutilized, that there's so many different resources that, you know, I didn't even realize. And for someone who's elderly that maybe can't get out, they may not know that those resources are there too. I would have never thought about fraud or victimization or those kinds of things for an elderly person, but there was a nice display of help and services for those people as well. So the aging office also provides daily meals. So at their senior center, they have daily meals for those who can come out of their homes. From 9 to 1, they can come get a hot meal Monday through Friday. For those who are homebound, not able to come out except for maybe light occasions to go to a doctor's visit, there is a volunteer service where meals are provided, and volunteers then take those every day to those people so they have a hot meal. The Pennsylvania Department of Aging also has a medical waiver that helps to pay for in-home services that someone would maybe get in a nursing home. So this allows a grant for the person to be able to use those services in their home. So that could be for adult daycare or for in-home care, but it is just another way to try to help people be able to stay in their home just a little bit longer. There is a huge waiting list for the home care and the adult care. I found it interesting talking with Karen that the list is kind of combined. So if you have someone that is priority number 1 for the adult daycare, but the home care is available, you can't skip among different people. So at the end of the month, they kind of pool those resources. I did feel like it was maybe kind of counterproductive, not divvying up the resources throughout the month and then people had to wait longer, but they have systems that they've used there for a very long time. So while I was there, I couldn't break confidentiality and talk to anyone coming in the door to get services, but it was suggested that I go over to the senior center that is run by the Office for Aging. So there I spent about 2 hours and I got to meet some very wonderful people. That senior center is actually in a HUD building for low-income housing. The bottom level is rented out by the senior center from the Office of Aging. So Miss Francis here, she has been there for 10 years. She's lived upstairs and attends the senior center downstairs. She was getting a hot meal there when I visited with her. She said that, you know, she loves it there, but as laws have changed, and she's very aware of her surroundings, it has affected her living conditions. So because she is in a HUD low-income apartment there, it's not just senior citizens anymore. People who have maybe mental health issues that are younger are also able to be there. Also some older people that need maybe even further care but can't afford to get into some of the private locations are also there. So she had explained to me that when she first came 10 years ago, there was a lot more to do, and people came out of their rooms, and it was a much more group environment. But now it's only a small group that visit the senior center, and that it is a little bit scary as well, having to live with other people that have some mental issues. And so that's one of the things that she voiced a concern to me. You'll also see that there's college volunteers in this other photo here. So the Gettysburg College once a month prepares a hot meal and brings it over, and they have a big party with the students and the residents and the seniors there, and that's something that they really look forward to. So not everyone's family is local, so at the senior center when these college students come in, it gives them kind of a breath of youth and something to look forward to. So it's great that our local college is able to help them with that. So while I was at the senior center, I also met with a woman named Louise. I asked Louise how she felt about the services that were being provided to her from the Office for Aging, and when I talked to Karen, she had explained to me that the funding, which I'll talk about a little bit later, comes partly from donation. Part of their donations is the people that receive free services, like Louise. At the end of the year, they put together a list and they send a letter out and they say, if you had used these services, if you had paid for these services, this is how much money you would have spent. But we provided them for free. Please give a donation. Karen at the aging office thought that was a great way to show people how they could give back. Louise, however, found it very offensive and felt that it was a free service and that she had earned that, and was very offended that now they wanted her to almost pay back. So it was ironic to see how that situation kind of went out. There was a big disconnect between the agency and the actual user of the services. So the Senior Center is funded by volunteers. There is one paid director. Everyone else is volunteers there. The location is also not very good. There's no sign that says that it's a senior center. So if you were just driving by, you would have no idea that those resources are there. There is also the mixed housing I talked about, so that is also an issue that they have there. So this is the dining room area at the Senior Center, as well as some snacks that they have and a Christmas board. They keep a board updated with the date and the day and the season to help the older residents that maybe don't keep track of those things keep their memory active. There's also a ton of board games that they were also playing there that day as well to kind of keep their mind going. So client referrals happen through a couple of different ways. Medical agencies refer people, home health care, hospitals, family members, and self-referrals. Most of the referrals come through a medical agency or a hospital where Medicare was taking care of someone. Then they go to rehab, and then when the rehab money kind of runs out is when the agency kind of takes over. So that's the majority of the referrals that the Office for Aging receives. To be eligible for services, you have to be over 60 and have a need. So income is not necessarily a requirement. You also have to live in Adams County to receive the services from that office. There's a basic intake, and it's all verbal. They don't require anyone to fill out forms on the computer or do any kind of formal application. It's just a verbal conversation from the get-go. Most of the time, the caseworker will go out to the applicant's home, even if they can come out of the house. They'll go to the home to assess the situation, see what kind of needs or services the person might need. At that point, once they assess everything and figure out what the person's going to need, that's when they do the income assessment. So then they look at how much does the person make, what are the services that they're going to need, and then they figure out if they need to do a cost sharing or if they can pay for those outright. So the cost sharing was very interesting to me. They have 460 senior citizens that they are helping right now. Only 30 of those are actually participating in a cost sharing situation. That means the rest of them are receiving these services completely free. Once the intake and the assessment is done and the services are decided, then there's a priority score that is assigned. So the priority score basically will say, you know, this person's needs are extremely important and we're going to put them at the top, and there's a form that they fill out electronically to do that. But again, that's all done by the caseworker. There's laptops and hotspots assigned to those caseworkers so that everything is done electronically. One of the things I thought would be great is that technology system that we had kind of talked about in our discussions with the human services. Because there's so many different agencies involved, whether it's for food or for medical or transportation or other needs, it would be great if there was one system that kind of tracked the services that the person was getting. Also, there's also people that maybe they've gotten better and they're doing well, but then they end up back on services again. So seeing what services they had before or what programs they were in would really be useful. There is a database within the specific services from the agency, but it doesn't link from outside agencies. So funding. So it's nonprofit. Most of the budget is state budget. If the budget is not passed, which last year was a situation where it was 7 months and the funding just wasn't there, the office had to take out personal loans from banks or business loans from banks that then they had to repay in hopes that the money was going to be funded from the state budgets. The PA Department of Aging gives the block grants in order to do the funding. The lottery, with my misconception, they funded quite a bit for the elderly, but it's really more just the transportation systems that the lottery is funding. Donations, again, are given by those who receive services throughout the year and then want to give back, as well as private donations. The local tax bureau, they get a letter from the Office of Aging every year saying, you know, this is what we spent, this is how we took care of your citizens, please consider donating. They don't have to donate, and the Office for Aging doesn't get any local or borough taxes, so it's completely on a donation basis. The cost sharing that I talked about is also a way to get income, and the PA Department of Revenue really helps out with senior citizens in their taxes. They provide waivers, and they help relieve the senior citizens of having to pay their taxes for the real estate. While I was there, I talked to Vicki, who was the financial director. She really did not have a lot of information to share with me other than to visit GuideStar, which I thought was a fantastic resource. GuideStar takes all of the nonprofits and it explains their tax returns, what they made for the year, what went out for the year. It actually listed 450 volunteers for 2016. Every year, the funding that the Office of Aging has received has increased consistently for 4 years by $100,000 to $300,000. So they're doing great with their funding. They're on track where they need to be. I was a little disappointed by the ethics and diversity conversation that we had. So the Adams County is 92.3% white. 12.3% of the population is over 60. The total population in Adams County is 101,767 people. So that puts about 1,000 people over the age of 60 who are minorities. When I asked about ethnicity and diversity and inclusion, Ms. Markle told me that they really don't know what happens to those people that are minorities, that they assume that families take care of them or they move back to other countries, but really there was no push and there was no program to include those people. She mentioned that they use a lot of the a la carte services, so when tax seasons come, they might help with that. They have insurance carriers that come in and do counseling, so sometimes people will come in for that, but they also don't use that time to let the people know what other services that they have available. So what she explained to me is that less than 2% of their clients are non-white. So they only serve about 20 non-white senior citizens in the entire population of Adams County. There are no efforts or programs in place targeting aging minorities in Adams County. The ethics, there's no code of ethics that they go off in-house. Everything is through the code of ethics for social workers. There was no papers that they could give me in-house, but the Department of Aging, as well as the website for the social workers ethics, was very, very helpful. It's a 36-page, easy-to-use guide. It's a very specific resource. It has, standards, program standards, HIPAA standards, staffing requirements. And then on the website for the State of Department of Aging, you can also find grant and funding policy and procedure manuals and record retention. So I think it's important, they're governed by the State Department of Aging, and there are some specific guidelines that they must follow. What is challenging and what impacts them is the state budget, healthcare laws, especially when Obamacare and Marketplace Care came about, as well as the new Managed Care Act coming up in 2019. That may actually allow private insurance funds to be able to be paid to the Office of Aging in order to manage the care for the clients of the Office for Aging. So that'll be a brand new field that they haven't been able to get funding from before. So for a human service worker in this industry or in this agency, there's definitely some challenges. So one would be, funding. Service availability, because services are limited, funding is limited, as well as staffing. Not having enough staff puts a lot of extra stress on the other caseworker. Like I said in the beginning, they're carrying 110 caseload versus 90. So some of the things I took away from this is, overall, I feel like there's definitely a lot of services that are underutilized. I think the diversity program could be done a little bit better. The location of the senior center that's funded by the agency, if it was more known, I think it would be more used. And the abundance of resources are just fantastic. So I think that is one great thing that the Aging Center has going for it. They have a great amount of funding. They seem to be doing very well with their volunteer program. So overall, it was a great visit, and it was nice to know that those resources are there. Thank you.